itching is a really common symptom in patients with MPN. And if your doctor isn't asking you about that, know what to talk about it, because sometimes, patients may be embarrassed or they think it's maybe a trivial symptom who talks about itching. But it is a real symptom, and it really can be very debilitating in terms of affecting patients' quality of life. So there's many different ways of approaching itching. Medications that lower blood counts, like hydroxyurea, to a certain degree can be helpful for that. Medications like Claritin, Allegra, Zyrtec, kind of allergy medications can help with itching as well. In the winter, especially if patients live in cold weather, patients can experience a lot of dry skin. And so everybody can really feel itchy in the winter. And so managing those things are important also, and making sure that your skin is, you use a good moisturizer is important. And then lastly, and thankfully, for patients where all of those treatment options haven't worked, Jakafi is really a very good medication for managing itching. And so I would say it shouldn't be the first drug that's used for every single patient, but if a good effort has been made to try other medications, try moisturizers, try the medications like Claritin, et cetera, and it's not working, then Jakafi is really an excellent medication for that. Being aware of the fact that patients with MPNs can have very specific symptoms is really important. And so as an MPN doctor, and this was going to be the last thing that I wanted to tell you if it didn't come up, was as an MPN doctor, it's really important to be aware of the fact that patients have symptoms and to ask about those symptoms in a very systematic way. And so in my clinic visits, I always utilize what's called the MPN SAF, or the Myeloproliferative Neoplasm Symptom Assessment Form. And like any form, it has its limitations, but at least it reminds the doctor that there are all these symptoms that are really specific to MPN, like itching. And so as a patient, you can also learn about the MPN SAF. It's a really easy form to find online. It's a 10-point questionnaire, and it asks you to rate symptoms on a scale of 0 to 10, where 0 is no symptoms and 10 is the worst. And it is important to kind of like look at that and think about that and say, oh, maybe this symptom that I'm having is actually related to my MPN. I should talk about it with my doctor. So as a patient, you can kind of go into the visit having thought about that beforehand. And so if your doctor isn't asking you about that, talk to your doctor about that. Tell them about that. And then I like to utilize the MPN symptom assessment form to make sure that our treatment is working. So, what I tell my patients is we can look at blood counts from a year ago, 2 years ago, 5 years ago, and get a trend and be very specific. But with symptoms, it's a little bit harder because they're subjective. And so it's hard to remember what I felt like yesterday, let alone like 5 years ago. And so if your doctor has been, asking you about MPN, your MPN related symptoms, then you can see where you were a year ago, 2 years ago, and kind of see if your treatment is working or not. So I think that that's really, really important.